Case Study Neurological Disorder Part 2. Since you have been on scene, you have identified the patient's breathing is progressively getting worse. You decide to give her a nebulizer with 6 to 8 liters of oxygen per minute to help reduce wheezing. You give ipratropium bromide as salbutamol has a higher risk of causing significant tachycardia or tachyarrhythmias. Your colleagues struggle to obtain much medical information as they're unable to access the patient's GP track record despite the patient giving consent. Due to the patient's worsening symptoms, you decide to take the patient to hospital. However, due to the patient's poor mobility, which has been more reduced since becoming ill, it's not easy to transfer the patient to the ambulance. As you transport the patient safely in the ambulance, you repeat a set of observations which show airway patent clear as the patient is talking to you but unable to complete sentences. Breathing rest rate 28, oxygen saturations are 91% on nebulized oxygen, work of breathing labor, wheezing slightly eased after nebulizer. You give oxygen 15 liters per minute via non-rebreather mask, which helps increase oxygen saturations up to 95%. A non-rebreather mask is used in emergency situations to prevent hypoxemia. Remember to fill reservoir bag to deliver 85% to 90% oxygen. Circulation color pale, cyanosis, heart rate 150, pulse weak and thready. Blood pressure 160 to over 82, capillary refill time under 6 seconds, ECG atrial fibrillation. You decide to gain IV access and give a fluid challenge due to heart rate over 90 beats per minute. Capillary refill time over 2 seconds. Respirate over 20 breaths per minute where you give crystalloid fluid 500 ml over 15 minutes. These fluids are first choice in sepsis. Disability confused, GCS 14, pain score of head and joints 7 out of 10. Once fluid challenge has been completed, you decide to give paracetamol 1 gram IV over 15 minutes to help relieve and manage the patient's pain. Exposure top to toe, front to back, maintaining dignity where there was no signs of any injury sustained. Patient suddenly becomes unconscious, unresponsive. You decide to use ABVM to provide positive pressure ventilation on 15 liters per minute, as patient was presenting SATs 84% rest rate less than 10. Your colleague will now pre-alert the resuscitation team of the receiving hospital.